Today we're going to talk about amplification. Hearing aids aim to make speech accessible by amplifying it. Hearing aids can offer considerable benefits to those who have a hearing loss, but they cannot restore normal hearing. They are, as the label suggests, an aid to hearing. Access to such technology can be life-changing, particularly for those with a mild, moderate or severe hearing loss. Such access is vitally important for children who are born with a hearing loss or who acquire hearing loss in the first year of life, if that child is to learn to speak. For those with a profound hearing loss, traditional hearing aids may offer few benefits. For adults with acquired hearing loss, hearing aids offer the opportunity to stay in touch with friends and villagers rather than becoming isolated. Hearing aids offer many sophisticated options to a listener, but are limited in providing access to speech in a noisy environment where lots of people are talking. As aids are designed to recognise speech, if there are multiple talkers, the hearing aid would amplify all speech, not simply the person the hearing aid user wants to hear. The World Health Organization provided minimum performance requirements to guide the mass production of low-cost hearing aids. In addition to the minimum performance parameters, the WHO recognised the importance of challenging environmental factors that hearing aids may have to work in. They recommend an operating temperature range of 5 to 45 degrees centigrade and with a humidity range of 0 to 80%. The average price of a hearing aid places this outside the means of the majority of potential hearing aid wearers in low and middle income countries. Even where hearing aids are provided free of charge, they require a power source. Typically, hearing aids use zinc-air batteries that are not locally available in such countries, or, if available, are too expensive for the user to purchase. One simple and effective solution to this problem is the use of solar-powered batteries. These can be recharged repeatedly. Such batteries are designed to be weather and shock resistant. The aids made by Gadisa use a rechargeable nickel metal hydride battery charged in a solar-powered charger. In a study of the efficacy of rechargeable batteries, they found that they maintain performance as well as the standard batteries in basic analog, simple digital and advanced digital hearing aids. Solar-powered aids have been developed by Solar Ear, initially in Botswana by Gadisa, but now in Brazil, with related projects in Jordan and Pakistan. Hearing aids can be mass-produced but require a custom-made ear mold to deliver the sound to an individual's ear canal. In many areas, ear tips, ready-made simple domes, are used. The World Health Organization recommended a two-stage ear mold process where an impression is made of an individual's ear. This is then used to make an ear mold of either soft or hard acrylic or soft silicone. This typically requires an ear mold laboratory and trained technicians and has significant cost implications. Many hearing aid users prefer soft canal tips to hard, bulky acrylic molds. Where hearing aids are provided, they need to be worn all waking hours in good working order and with meaningful input. This is challenging when hot, humid conditions and dust may be exacerbated by poor management regimes, where there is a lack of training and local understanding. The 7 main commercial manufacturers serve 90% of the current market. 3 countries, Botswana, India and China, offer more affordable hearing aid options. A major problem is that some countries charge considerable import duties, and to address this challenge, hearing aids can be bought in kit form. As there is limited or no import duty on parts, the hearing aids cost far less. The challenge is then reassembly in good working conditions and final product testing before issue. Worldwide Hearing provides care for low and middle income countries in affiliation with the World Health Organization. Worldwide Hearing partners with a range of organisations and institutions. It recognises the political, economic and social factors that impact on the provision of hearing aids. It has adopted 6 major working principles: prevention, research, education, equipment, training, and advocacy. By working with the WHO, all member states of the World Health Assembly, it seeks to create and develop cross-disciplinary partnerships and forums for discussions to promote debate and disseminate information. By recognising the current main barriers to hearing aid provision, Worldwide Hearing has sought to use a community-based approach through a programme called Hearing Express. The 3 cornerstones of this project are affordability, rapid fitting and delivery. Hearing Express uses low-cost digital hearing aids as well as self-fitting hearing aids with software-based technology on a laptop or Android device. It promotes the use of open-fit and traditional ear molds and the use of solar rechargeable batteries. Rather than seeing this as a medical intervention, Worldwide Hearing have promoted a community hearing aid and communication programme. As an example of Hearing Express, I'm going to talk about a project in Jordan. This was a pilot project, Community-Based Hearing Aid Programme, or CHAP. In terms of affordability, Hearing Express package provides a digital self-programmable hearing aid, a desiccant-based dryer, sturdy solar-powered chargers and rechargeable cells. This project aims to fit those with a mild to moderate hearing loss, with severe hearing loss starting to come into the programme. It uses slim tube with a tip or dome rather than a traditional custom-made ear mould. For community-based services, local personnel may deliver a service by car, tuk-tuk, bicycle or on foot. Community hearing aid technicians know the community they serve and undertake home visits. A trained audiologist and the local project director train the chat over a period of 1 week with additional shadowing, theory and practical sessions. Chats have screened and referral responsibilities. They are trained to do the following: perform ear inspection. Any pathology is referred to the project ENT. If the ear canal is clear, a hearing aid is fitted and tried with the user choosing hearing aid settings. If chosen, the hearing aids are sold at World Healthy Hearing prices. Ear mold batteries and dehumidifiers are sold at the set price. After an initial counselling session, monitoring visits check functionality of the aid. If anything outside the chat's area presents itself, the client is referred to the programme audiologist or the main clinic approved by Worldwide Hearing. At all stages, any action taken with each client is recorded on the tablet using a client app developed by students at Stanford University. Internal oversight is provided by the Montreal office of Worldwide Hearing. Currently, in high-income countries, the technological approach to profound hearing loss is cochlear implantation. This is a sophisticated implant that requires detailed consideration of medical appropriacy, requires surgery and long-term follow-up. Whilst this is not a realistic option in many low-income countries, in some areas implants are now a realistic option. For example, in India and South Africa, profoundly deaf individuals have received cochlear implants. This offers an opportunity to hear and to develop spoken language. Whilst for the majority this is not an option, it is an area of growth and will continue to develop and change expectations.